Hi, I'm Naisha McCauley, and you're watching AccessTV.org. How much do you know about CLAS? I'm not talking about high society. I'm talking about healthcare, specifically the CLAS standards, culturally and linguistically appropriate services. Head scratching yet? Not to worry. Today's episode will not only give you insight on these standards, but show you how they can help you get better care. That's all here on Everything is Health. Hi, I'm Dr. Helen Newton. CLAS standards are a series of guidelines designed to help both individuals such as yourselves and organizations to achieve more culturally and linguistically appropriate services, expanding the horizon for healthcare, and aiding in the elimination in health disparities. Originally developed in 2000 by the U.S. Department of Health and Human Services, Office of Minority Health, they have since been expanded as of 2010 to better encompass our growing society. The goal? To reach more people and even save more lives by emphasizing the importance cultural and linguistic competency throughout the healthcare and health services continuum. In other words, making sure that everyone, regardless of background and language ability, is able to get the highest standard of care possible without any barriers. Sounds like quite the feat, doesn't it? Well, I'm sure that by the end of the show, you'll agree with everyone here at Everything is Health that CLAS is a huge step in the right direction. Bear in mind that we're not going to go over all of the standards today. We're simply going to highlight important things you, as a patient, not only need to know, but grow to expect upon walking in the door. Let's get started. Number 1. Expect CLAS to start from the top down, meaning that wherever you go, everyone from the janitor all the way to the CEOs should reflect the diversity of your community. Why is this important? According to the Office of Minority Health, evidence has shown that cultural diversity not only equals better care, but happier, more satisfied patients. Now, the Office of Minority Health doesn't expect this change to happen overnight, but you, as a consumer, should start getting used to the idea of a more diverse medical field. However, don't think of these people as tokens. CLAS expects all employees, regardless of ethnicity, to be culturally trained, which brings me to tip number 2, which emphasizes the importance of ongoing training, meaning that it doesn't stop after a seminar or two. It's recurring, happening more than once, ensuring that everyone involved has the tools needed to handle cross-cultural encounters. But don't expect them to rely on stereotypes. It is emphasized that all training shouldn't be based on generalizations, but sensitivity regarding beliefs, expectations, and communication, and how this information can help them provide better treatment. In other words, when you walk in, they should know how to treat you, and not just physically. Did you know that all healthcare organizations are now required to have language assistance services at no cost to you? This means that they must have either trained interpreters or bilingual staff available at all times throughout your entire visit in a timely manner. They are also required to tell you these services are available with no price tag, whether it's verbal or in writing, in your preferred language. I know what some of you are thinking. I can translate for my family member. Why do I need an interpreter? According to the Office of Minority Health, grave errors have occurred as a result of miscommunication between doctor and patient. For example, a first responder misinterpreted a single Spanish word, intoxicado, to mean intoxicated, rather than its true meaning, sick to the stomach. Because of this, the patient ended up becoming quadriplegic as a result of the delay in getting to the root of the problem, resulting in a malpractice settlement. Now, to be clear, we're not saying that you shouldn't be involved in the process for your loved ones at all. On the contrary, this law is designed to make things easier for you so that you don't have to shoulder the burden of translation. Take advantage. Speaking of language, regardless of whether you're walking into a doctor's office or a clinic, and this is required by law if they receive federal funds, they should have material that is easy to understand and available in languages that are commonly spoken in your community. No matter how much or how little you know about medicine, you should be able to comprehend whatever is provided for you. These aren't limited to those little pamphlets you see strewn around the office. They also include consent forms, waivers, living wills, discharge forms, financial obligations, benefit coverage packages, non-coverage notifications, and so much more. They even include instructions on how to take care of yourself, a loved one before and after surgery, how to prevent disease, and as we mentioned earlier, general health information, including screenings. Basically, anything that helps you make informed decisions about your health. Under CLAS, health and healthcare organizations are encouraged to collect data about information such as race, ethnicity, sex, language, and disability status. Bear in mind, they aren't collecting this information for fun. Not only is it required by law under the Affordable Care Act, or more notably Obamacare, for health surveys, but it's also used to help them tailor their health services to the community, use resources more efficiently, and help them maintain class by knowing their demographics for optimal patient care. It's important to note that you are required to know how they are using your information and that you do have the option to opt out. Also, all organizations have restrictions on how they can use your information, with your consent, of course. While we're on the subject of you, let's talk about outreach. Health and healthcare organizations should be connecting with you, engaging with you and the community, getting your feedback on their services, making them around you. Why? According to the Office of Minority Health, input from the individuals of the community is essential to planning, implementing, and improving services. Think of it this way. If they're not reaching out to you, they don't know you. If they don't know you, they can't help you, at least not as efficiently. For example, and this is an excellent one from OMH, if an organization sends out the message that more people should be walking outdoors, and you live in a neighborhood where it isn't safe, that seems a bit out of touch, doesn't it? Outreach lets them know how they are perceived, what issues need to be addressed, and how to address them, all thanks to you. This brings us to our seventh and final tip, your right to address grievances. Organizations under CLAS are encouraged to allow open communication of issues, especially ones concerning discrimination and unfair treatment. Now, this doesn't have to be an outright event where a caregiver is blatantly racist, sexist, or classist. It also applies to situations such as informed consent, access or denial of services, even notions you perceive as a patient while receiving care. In fact, as stated in the standards themselves, all individuals must be informed about and have access to feedback procedures that cover all aspects of their interaction with the organization. In other words, not only are they required to tell you how to give feedback, but the feedback itself must be available to you, and they should be able to address it, no matter what part of the service you have an issue with, or even a compliment. Expect them to know what they're doing as well, to respond to you in a way that you understand, and for them to keep your privacy while keeping the procedure behind their response transparent. You shouldn't be in the dark behind their process. They should be able to tell you how they address conflict and who specifically handles your situation. Not up to facing them head to head or want to. Services should include both formal and informal means to get both positive and negative feedback. Finally, don't be afraid to send it. These institutions should expect and have responses to any type of comment and be culturally sensitive throughout. In fact, under CLAS, they should have policies, programs, and even entire committees in place for patient relations and legal issues according to OMH, Office of Minority Health. So, if you have something to say, say it. Never be afraid to raise your voice, especially when CLAS has your back. All right, that's all we have for you today. Thank you for watching. We hope these tips have helped you get on the road to better care. For more information on these standards, as well as even more tips, go to www.thinkculturalhealth.hhs.gov. I'm Dr. Helen Newton. On behalf of all of us here at Everything is Health, so long and stay in good health.